Hi, I'm Dr. Harry Lawson, the Chief Medical Officer for SIU Medicine, and today I'm joined by Dr. Chris McDowell, the Department Chair for Emergency Medicine at SIU. Welcome, Chris.
Hi, Harry. It's good to be with you.
Thanks for being here. You are an emergency medicine physician. You're practicing. You're working in the ER today, as a matter of fact. What would you like to tell the community out there about the emergency room, the emergency department, and what precautions have been taken right now?
Thanks, Harry. It's great to have the opportunity to talk with you today. First and foremost, I want people to know the emergency department is ready to take care of you, as we always have been. And if you need us, we're here for you. So you're probably asking yourself, what's it like in the emergency department right now? Well, locally, our hospitals have done a great job of preparing extra capacity so that we can handle anybody who needs to seek care in these emergency departments. If you come to the emergency department, you'll notice that some things are different. First and foremost, the triage process, or how we greet you, is very different than it was a few months ago. If you come to the Memorial Emergency Department, you'll be greeted in your car outside. We'll ask you a couple screening questions and then bring you to the ambulance bay where we'll ask you more screening questions. You may be asked to wear a mask, and then we'll get you into the emergency department in the appropriate place so we can provide care for you. The reason we've changed that is to make sure that we can keep it a safe environment for anybody who seeks care with us.
So patients may be concerned that they shouldn't come into the ER even though they're having symptoms that are concerning. And they might even wait before they come in to see you. What would you have to say to those patients out there? You're having symptoms, it could be something that really needs to be addressed now, but they want to delay coming in. What would you say?
That's a good question, Harry. We want people to understand that we're able to deliver the care that we've always been able to deliver in the emergency department. Let me give you some examples. If you have a history of heart disease and you're having chest pain and we're worried about you, we want you to come see us. We're ready to take care of you like we were any other time. As I mentioned, we're doing some things differently to screen and protect you for whatever reason you come to the emergency department. We may ask you to wear a mask. We may put you based on symptoms in different parts of the emergency department so that we can provide the best care. We're screening people both outside when they come to the emergency department as well as when they arrive by ambulance so that we can get them to the right place. But rest assured, we're here to take care of all your needs, from chest pain, abdominal pain, things related to respiratory illness like COVID-19, and everything else that you've always counted on your emergency department to do for you.
And along those lines, how are things going in the emergency department now? How's the volume of patients? How's the staff responding? How are they doing as far as reacting to the current pandemic and taking care of our patients?
When you come to the emergency department, you'll notice that some things are different. You will see that we're wearing a lot of different equipment from what you might have seen on a previous emergency department visit, things that we refer to as PPE. But we're simply doing that so that we can keep you safe as the patients, as well as us as the staff. I've been really heartened to see how our staff has responded all across the board. They want to take care of patients and do everything they can to provide the best care. You'll also notice sometimes that emergency departments are not quite as busy as we were 2 months before because we're preparing and doing some things differently in the healthcare system so that we can get people care in whatever venue is appropriate. But once you get to the emergency department, we're seeing people who are a little bit more ill. And I think this gets back to a point that you were talking about before. If you have a health condition or a concern that the emergency department's the appropriate place for, come see us. We don't want you to wait 2 days with chest pain at home before you come get evaluated. If you have a chronic medical condition, if you're getting chemotherapy for cancer treatment, if you've been in the hospital recently and you think your symptoms have gotten worse, that's why we're here for you. We want you to come back so that we can take care of you.
Any other things that you want to mention to the patients we serve our communities? Maybe one or two key things that we want to, maybe it's repetitive, but we want to really stress so that everybody hears what we need to say.
Sure. First and foremost, it's safe to seek care in the emergency department. We are redesigning every day so that we can meet the needs of anybody who comes to see us. Secondly, you might notice some new things when we discharge you if you're going home. We're doing some different things in the outpatient space around telemedicine to get you an appointment with your doctor maybe more quickly than we would have before. Third, we're discharging you sometimes with pieces of equipment to help take care of you. For instance, we're now sending some people home with a pulse oximeter or a simple probe to put on your finger to help measure your oxygen at home. If you've got certain respiratory illnesses like COPD or asthma, being able to manage your oxygen at home could really help us decide when you need to come back and see us. So we're learning from this, Harry. I think we're going to emerge able to take even better care of our patients, find new ways to serve them with things like telehealth, and be able to provide them ways to monitor themselves at home better than we could in the past.
Right. I think those are really important points, and we want to make sure that the patients that we're serving, the communities we serve, understand that all the precautions have been put into place in the emergency room for the emergency care that's provided. Take care of patients in a timely fashion, so don't delay coming in. The follow-up that you've mentioned has really been enhanced through lots of different ways. If you need to be seen in person, our clinics have lots of precautions put into place, screening at the door, questions like you mentioned that happen at the hospital. Everyone's wearing a mask. We're taking all the precautions necessary. And we're delivering telehealth. We have new monitoring capacity for a lot of these things that we know are related to COVID too, because that shortness of breath doesn't necessarily occur in every patient. And so measuring their oxygen, really important for those patients that we want to monitor. So all of those things are working together. The emergency room, the hospital, the outpatient clinics, everyone's working together to make sure that you have the safest environment possible when you're going through the system. Right?
I agree, and I would say if you live as a resident in Central Illinois, you should be proud of the collaboration across the healthcare agencies in our region. The Sangamon County Health Department, SIU Healthcare, Memorial Health System, HSHS St. John's, Springfield Clinic. We are collaborating at even higher levels than we have before to make sure that we do the right thing to meet the needs of all of our patients. We all live here. We want everybody to be as healthy as possible, and we want to emerge from this in a better place as healthcare organizations, and that collaboration is essential to that. It's a great environment to be working right now, and I'm appreciative of all the support that I have from SIU and Memorial specifically in my environment.
Great. Well, Dr. McDowell, thank you for joining us today. These are important messages, important information for our patients to know about accessing the emergency room and the safe environment that's been created with all the precautions that are necessary. So thank you again for bringing that message. Again, we want to thank everybody for watching the video today. And as always, stay well, stay apart, and wash your hands. Thank you.